Remember that unity and resolve to bend the curve, to stay home and save lives? It's being tested tonight across America, still facing death on a staggering scale, over 36,000 so far. But also in America, impatient to rebuild a crumbling economy, a restlessness stoked by the president today as governors across the country weigh their next steps. We've got it covered tonight, starting with Gabe Gutierrez.
Across the country, from offices to restaurants to air travel, a patchwork of plans to restart the economy.
It's a marathon. It's not a sprint. We are not really even halfway through, even though we've hit the peak.
State by state, the rules are dizzying. From Georgia to Louisiana to Arizona, many have stay-at-home orders that expire on April 30th. Others, like New York and Connecticut, have already extended theirs through at least May 15th. Missouri's governor wants residents to go back to work on May 4th, but the mayors of St. Louis and Kansas City will keep their stay-at-home orders through mid-May at least.
We're just not putting an end date on it, but we are committing to reevaluating this continually.
From New Jersey to Minnesota today, new protests demanding an end to the shutdown. Today, beaches reopened in Jacksonville, Florida. In Texas, the governor started easing some restrictions on state parks and elective medical procedures, but said schools should stay closed for the rest of the academic year.
We must be guided by data and by doctors. We must put health and safety first.
A new poll finds that by a 2-to-1 margin, Americans are more concerned that social distancing restrictions will be rescinded too quickly than too slowly.
It frightens me to think of opening up areas of the city and then going backwards again.
Experts warn that to reopen the economy safely, there must be testing on an unprecedented scale. Here in New York, as new sites opened today, the governor issued an executive order directing all labs to coordinate with the state to ramp up testing.
This is mayhem. We need a coordinated approach between the federal government and the states.
And new research from Stanford University suggests that the number of people infected could be up to 85 times higher than the official count. The study found that up to 4% of those tested in one California county had COVID-19 antibodies.
And my head is just spinning.
23-year-old Matt Newey from Utah survived coronavirus. He's skeptical of easing restrictions.
I would say we really need to take this slow and be very cautious because this could easily get out of hand again.
As America's death toll surpasses 36,000, today a moving tribute for Newark police officer Daniel Francis. He was just 51 years old. Gabe Gutierrez, NBC News, New York.
This is Peter Alexander after insisting governors would call the shots about lifting coronavirus restrictions in their states.
It's going to be up to the governors.
President Trump encouraging demonstrators using their own language, tweeting in all caps, "Liberate Michigan, Minnesota, and Virginia." All three battleground states have Democratic governors, and each has faced protests for their stay-at-home orders. The president asked about those conservative supporters Thursday.
They seem to be protesters that like me and respect this opinion, and my opinion is the same as just about all of the governors. They all want to open. Nobody wants to stay shut, but they want to open safely. So do I.
President Trump notably silent after Mississippi's Republican governor today extended his state's stay-at-home order. One Democratic governor tonight calling the president's tweets unhinged, warning he's putting millions of people in danger of contracting the virus. The president also attacking New York Governor Andrew Cuomo, saying he should spend more time doing and less time complaining. Cuomo firing back.
He's sitting home watching TV. Maybe he should get up and go to work, right?
And after the president accused Cuomo of inflating New York's needs for emergency medical equipment, the governor said his requests were based on federal projections.
They were the president's projections.
Meanwhile, in Washington, no agreement on replenishing the government's small business loan program after $350 billion ran out in less than 2 weeks. At her boutique wine bar near Houston, Benita Billings laid off 8 of her 10 employees.
We went from having an income to nothing.
She hasn't gotten the $18,000 loan she needs to pay her staff.
That's what I would really love for all of my employees to stay on payroll.
Among those who did get money, the high-end steakhouse Ruth's Chris, which made $42 million in profit last year, now receiving a $20 million loan.
And as for those direct payments from the federal government, millions of Americans began receiving them this week, but there have also been delays, mixed up payments.
and some confusion. Lester?
And Peter, I know the president at a news conference this evening was talking about testing. What did he say?
Yeah, that's right. Amid criticism about the lack of widespread testing, the president earlier today tweeted that it's the states that need to step up. But public health experts say testing problems right now are largely the result of a vacuum at the top with no national testing strategy. Lester?
All right. Peter Alexander, thanks. And as we have reported extensively this week, this pandemic is taking an especially deadly toll on nursing homes, with many families fearing for the lives of loved ones, a growing concern about the lack of supplies and workers. With more, here's Kate Snow.
Tonight, New York warning of a deepening crisis. 19 of the state's nursing homes have had at least 20 deaths each, including the Sapphire Center in Queens, where staff shortages mean it's hard for families to get information. Leona Figuera talked with our Ron Allen. 1 week ago, she tried to FaceTime her sister there.
I called the coordinator, and she told me that she could not get to the room. It was closed. I then called the desk, the nurse's station, and the nurse told me, yes, she passed away about 3 or 3:30.
So no one ever called you and gave you some official explanation?
No, she asked me if the doctor had called me, and I said nobody called me.
Amid demands from governors in New York, Michigan, and Ohio for nursing homes to be more transparent about coronavirus cases, today West Virginia's governor went even further, ordering every single resident and staff member in nursing homes across the state to be tested. Some governors sending in the National Guard to help.
We need the protective gear that we should have to take care of these residents. We have children, we have our own family to go home to.
In a new national survey of care facilities, 70% say they're not fully prepared for COVID, and nearly half are having staffing challenges.
Nursing homes are really struggling right now to find individuals willing to work.
At that facility where authorities say 17 bodies were found in a morgue, the county health department today disputing management's claim that staffing was solid. Many workers at nursing homes are falling ill themselves, about a third of the staff at Belmont in Boston. Angeline Bernadelle died after working as a nurse at a facility in Connecticut. And experts are concerned that some employees are coming to work sick.
Oftentimes they'll feel pressure from nursing home administration to keep coming in order to keep the building staffed.
But at San Simeon on New York's Long Island, each employee is screened at the door.
If I have a staff member call in with a headache, or if their spouse works with someone who tested positive, I'm keeping them out 2 weeks with pay.
Director of Nursing Kelly Matero left her own family and moved in last month.
All our staff has been just so flexible and willing to go the extra mile for me right now.
To date, she says, they've had no cases here. Kate Snow, NBC News.
A tragedy within a tragedy. In the search for solutions tonight, the experimental treatment for COVID-19 showing promising early signs that it could be a breakthrough. Here's Tom Costello.
Celebration at Holy Name Medical Center in New Jersey as 69-year-old Shuming Liu was finally released after a month in the hospital. His son John says he nearly died.
He was very sick.
His father, in a coma and on a ventilator for 2 weeks, recovered after doctors prescribed an emergency treatment, a cocktail of drugs in IV form that included remdesivir, the experimental drug first designed to treat Ebola.
Without the medicine, what would have happened?
Without the medicine, I believe I won't even see my father again.
Mr. Liu, the first COVID patient at Holy Name to come off the ventilator. Doctors used remdesivir in combination with either another drug, Kevzara, or a placebo. They don't know yet. Whatever the combination, though, it worked.
We do not have enough data right now to conclude that they are indeed effective, but we have a strong feeling that they are.
In a snapshot of a clinical trial at the University of Chicago, Stat News reports nearly all 125 COVID patients who were treated with remdesivir were released within a week. Only 2 patients died. The university tells NBC News partial data from an ongoing clinical trial is by definition incomplete and should never be used to draw conclusions. Drug maker Gilead says we expect data from multiple studies to continue to evolve over the next month to help establish the safety and efficacy of remdesivir.
Sickest you've ever been.
Sickest I've ever been, yes.
In Philadelphia, Mike DeWan was on a ventilator for 17 days. Doctors don't know if it was the compassionate use of remdesivir that saved his life.
I feel very lucky. I'm extremely grateful and thankful, especially to the Penn Presbyterian staff, the nurses, aides, and doctors.
Importantly, this is not the drug President Trump has touted. Hydroxychloroquine is under separate review. But if remdesivir is proven effective, the FDA could give it the green light for emergency use within weeks.
Tonight. Thank you. As COVID hotspots grow in the heartland, the food supply at your local grocery store may start to look a little different. Here's Miguel Almaguer.
Tonight, with CDC investigators inside this meat packing plant in South Dakota, officials will soon determine when and if operations can resume at Smithfield Foods. More than 600 employees are sick at one of the nation's largest pork processors, leaving support groups overwhelmed.
There's a lot of fear. I have a lot of families calling me, what's going to happen?
The problems at Smithfield are shared by a growing number of food processing plants where the virus is spreading. From Pennsylvania to Wisconsin to Colorado, employees working in tight quarters have complained about a lack of protection. In Georgia, Willie Martin says his mother, Annie Grant, felt pressured to keep working at this food processing plant.
She said, baby, they telling us if we don't come, we don't get paid or we risk getting fired. And she had to go, you know.
Days later, Annie Grant died from COVID-19. Tyson Foods says it encourages sick employees to stay home. Now, because of the virus, production is slowing at packing plants, raising concerns over food supply shortages. Blaine Alexander is in Atlanta.
The National Grocers Association is warning that shoppers can expect to see some products temporarily out of stock until the supply chain catches up.
While food is available, for many, it's out of reach. Food banks nationwide are understocked and overwhelmed.
People don't have the money that they had a month ago, so they need to spread their dollar as far as they can get it to spread.
Tonight, our nation worried about our health and our food. Miguel Almaguer, NBC News, Los Angeles.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.